My name's Dr. Carol Geller. I'm a family physician. I'm working at Centretown Community Health Centre in Ottawa, an inner city community health centre since 1999. So since we're in inner city Ottawa, we have an extremely diverse population. It's always naturally made sense, the concept that you want as much access to your patients' information to provide them better care. And Connecting Ontario will allow me to do that. For instance, I have found consultations before where there were very clearly outlined next steps or next tests that somehow got lost. If I found that through Connecting Ontario, as opposed to having to fill in a consent to release and waiting to get it, I could institute that right with the patient with me at that visit. So it's not uncommon that I will have a patient come back with a history, a story of what's just happened to them. In my patient's case, he broke his hip. He ended up having significant investigations and interventions done.
We were at the cottage. It was the Friday before long weekend, and it was end of summer. I was up a ladder pruning the lilacs, and I fell off the ladder, and there happened to be a large rock beneath me, and it hit my left thigh and snapped my hip bone. So there I was lying there, and luckily my wife was close at hand, and she called ambulance, and off I go to Perth Hospital.
I luckily was kept abreast of all this because of his wife's awareness of accessing all the records and sharing them with me. If I had not had these records provided to me through her advocacy, one, I would not have been aware. He could have appeared in my office and I wouldn't even understand what had happened. Two, I would not have been able to have helped coordinate the ongoing care that needed to happen in Ottawa. If I'd had Connecting Ontario, I would have been able to, once hearing he'd been in the hospital, look up his records and have the full picture at that moment.
I would be very happy if my doctor could get information on what's happening to me anywhere in Ontario.